Greetings, everyone. Welcome to our channel, Caribbean Current. I am your host, Verio Morelon, and today we focus on COVID-19 vaccines with our guest, Dr. Joy St. John. Dr. St. John is the Executive Director of the Caribbean Public Health Agency, CARPHA, and we've chosen this very topical issue to share with you today. Dr. St. John, welcome to our channel, and thank you so much for agreeing to be our guest.
Thank you very much. I think I'm going to enjoy talking to you.
Okay, thanks. It's been a while. What's top of mind for you today? What's keeping you up at night?
The thing that really impacted me this morning was watching Vice President Pence and the Surgeon General of the United States taking their COVID vaccine. And I am very excited about that type of leadership because we need that type of leadership at this juncture in the COVID-19 pandemic. And I am hoping that around the world, the leaders, both political and health leaders, will be taking the vaccine.
Okay, good.
The other thing that's foremost in my mind is that although COVID has been difficult, in a way, it has been very good for me. In March, I came to visit Barbados, and Trinidad closed its borders and has not opened. So I've been stranded, but my family home is in Barbados. So it's allowed me to be with my family at a very difficult time. So for me, COVID has many silver linings, and that is one.
Okay, but so that means your executive team is still in Trinidad, so you have to link with them virtually.
Yes, I've been doing all of this virtually. Most of the work for COVID-19 has been virtual, but CARPHA has been specifically trained for this by the Arthur Lockjack department. And also because we put measures in place early on to ensure the safety of our staff, I consider them irreplaceable. A lot of our staff are teleworking, and some of them don't come in at all because they're in the vulnerable group, and some rotate, so they're in and out. So we never have overcrowding in our workspaces. So the virtual paradigm is not for me alone, but remember that we cover 26 member states. We do not have country offices. So we were already set up for a lot of virtual work.
Okay.
And we have 3 campuses, Trinidad, St. Lucia, and Jamaica. So the virtual paradigm is something that we were into. I was Zooming long before it became popular.
Yes.
Because of the work with CARPHA. Yeah. So for us, the transition to the virtual realm has not been as difficult. Of course, there are issues with the member states because we were doing a lot of visits to countries to get things going, to have meetings and so on. We've had to package them differently. We've restarted our work, but it's virtual. So we're finding ways to deliver the work quickly through the virtual paradigm because people don't tolerate being in front of a screen for a whole day for a meeting.
Yes, yes.
So we've had to change things, but it doesn't keep me up at night.
You take it in stride. Very good.
No, but I've been doing it since March.
There you go.
So I've found the rhythm to deliver.
Yes, got you. Well, for our members of our channel who are viewing our channel who may not know a lot about CARPHA, I see that it was formed from an amalgamation of 5 regional health institutes to kind of.
Yes, it's a very young institution.
Okay, and basically you provide a mechanism through which the region can take a regional response to a public health issue. What, in your view, in a nutshell, in 1 or 2 sentences, what would be the main goals of CARPHA? What is it you're trying to do?
Well, I'll tell you our motto: healthy people, healthy spaces, healthy Caribbean. And what we try to do to achieve that is to focus not only on the health and wellness of the people of the Caribbean, but also to focus on partnerships and not just just within the health sector, with a lot of different sectors. So when it came to COVID now, and all of this multi-sectoral work, which was necessary in order for the different sectors to return to functioning, it was already a way of working. So the intention of CARPHA is not just to focus on health, also with bringing the economies back online regions, and we have a tourism and health program, and we're trying to find ways to return to tourism safely, not only for the tourists but also for the host countries. So our CARPHA intentions for COVID are just like an amplification of the way we've been working. It's like COVID has all of our working on steroids, more or less. So in the usual frame of thinking, the old way of working, CARPHA did a lot of multi-sectoral work. CARPHA did a lot of work with non-governmental organizations, and that continues.
All right. So, so you were telling us about the main goals of CARPHA, and
Yes.
what I wanted to ask you, Dr. St. John, yeah, is what will you say are the key successes that CARPHA has had so far? I mean, in your view, what are the major successes?
All right. So I'm going to try to give you a little pre-COVID and then COVID.
Yes.
So the successes have been that we have really shaped an organization which is for the Caribbean people. Most of our staff, 99% of our staff, were born right here in the Caribbean. So we really understand the Caribbean paradigm, the ways that people work, the ways that people play, the ways that people also get angry, because that is important when you're trying to resolve
Yeah.
conflicts. And the other thing that I think is important about CARPHA in terms of its successes is that it has had a history of interacting with the CARICOM governance arrangements. And this has been amplified under COVID-19. We have interacted with the heads of government many times. So we have been able to get the political decision making for functional cooperation in health. We have been able to support the Caribbean moving forward together, strengthening capacities in many areas. And I think another very important achievement of CARPHA has been the Tourism and Health Program. It has also been the Field Epidemiology Training Program. It has also been the fact that all three of our laboratories, the medical microbiology, the drug testing laboratory, and the environmental health laboratory, all three of them are accredited. And we have gone through accreditations and been accredited. So we have a Caribbean product, which is tailor-made for Caribbean needs, and it has international standards that it has maintained.
Yeah.
So I am very proud of those achievements. Now let's talk about COVID.
COVID. Okay. Yes.
The COVID achievements, I think, have been the fact that we have been able to produce several of the mandates, if not all of the mandates, that the heads of government have given to us to achieve regional solidarity, travel protocols, and we have also been able to ensure the primacy of public health in the fight against COVID-19. We have seen other jurisdictions where the profit motive was most important and people's health was profit motive were more important. And we have seen how that kind of approach can cause widespread illness and death. And in the region of the Americas leads all of the regions in terms of illness and death.
Oh,
No one comes even near to the region of the Americas. In
wow.
the region of the Americas, the CARICOM subregion, don't say the Caribbean because the wider Caribbean
Yeah.
has other um, non-English speaking countries. And when you look at the numbers of illnesses and death for the wider Caribbean, the CARICOM subregion of the wider Caribbean makes up a small fraction of that. And if you take the CARICOM subregion alone, in the
Mhm.
whole of the Americas, we have the best rates per capita of illness and death. Um, Maybe later I can share some of our epidemiology slides with you so you will get an idea.
Mhm.
But it is not only that, it is also that the heads of government have moved as one. There has been almost a choreography.
Mhm.
And I think that goes down to the work of the ministries of health and CARPHA in explaining the science so they understand. Of course, we're small countries. We don't have millions of people that we can put on um, the sacrificial block of COVID 19.
Yes. Yes.
So the heads of government have realized for me to come out of this with my constituents, I have to pay attention to what keeps them healthy.
Yes. Thanks. Thanks for that. No, no. What I'm hearing, and one of the things that drove me to for us to have this chat is the amazing amount of false information, and as well as when we come to the vaccine, there is a certain amount of resistance all over the world. But in the Caribbean, I'm also hearing a lot of people resisting. I mean, my peers, my children, they
You're
all,
talking about the vaccines.
yes, the vaccines. Why
Yeah, okay.
they wouldn't do it? No, no, no. One of the ones I want to focus on, and we can probably talk about others, but I think one of the ones my peers are telling me, they're saying, how can we be sure that the Caribbean is going to get high quality vaccine, the same type that the European Union citizens are getting, the same type that they're getting in other parts of the developed world? How will we be sure that we won't get something substandard or something fake? And so what is CARPHA's role in that?
Okay, so I'm going to start first with this thing about fake information. From day one, there has been fake information generated right here in the Caribbean, which, if it was not countered quickly, could have really done us damage and done damage to our tourism product. So there's been a lot of fake information about all aspects of this COVID-19 pandemic and how the CARICOM region has responded to it. But when we're coming now to the vaccines from March, I realized that this group called the anti-vaxxers were flooding the Caribbean with um, information about the vaccine, which would suggest to persons who did not understand how things worked that it would be detrimental to their health to take the vaccine. So I am not surprised that at this stage that the vaccine is being distributed, that they have ramped up their efforts to a level that I have never seen before. And I've been in public health a long
Mm.
time. And it has been taken up by not just the ordinary CARICOM citizens, but also healthcare workers who are not in public
Mm.
to ensure that the Caribbean and CARICOM especially gets the correct vaccine. There are several things in place. There are several layers of due diligence.
Yeah.
First of all, on the steering committee of this overall entity, which is looking at access to um, other things other than vaccines to fight COVID 19, treatments and so on, and the COVAX facility. There is the Honorable Timothy Harris, who is the Prime Minister
Yeah.
for Health in the quasi cabinet of the heads of government.
Oh.
He is the Prime Minister of St. Kitts. He is on the steering committee. So we have that, someone right at the top to help us. The other thing is that COVAX will have its own due diligence so that only safe, efficacious, registered vaccines will come to um, the region of the Americas. PAHO is a big player. Now, I used to be an immunization manager years ago in Barbados, and I know PAHO is very good at getting vaccine from manufacturer to the port of countries in good state. And we're dealing, at least this first one, Pfizer is minus 75 degrees for its cold chain to be maintained. So we have a tried and true, well-known player in PAHO to get the vaccines to port in the region. Then CARPHA has drug medicines regulatory. We have the pre-market surveillance, the Caribbean regulatory system, and they check the dossiers of the whatever is coming into the market that is made known to us to make sure that it is what it says it is and it is the quality that is circulated in other jurisdictions. That's pre-market surveillance. Then we have post-market surveillance with the Medicines Quality Control and Surveillance Department in Jamaica. Unfortunately, it does not test for vaccines, but all of the other treatments around COVID, they can test for, and they have a program with member states. And then in between there, if there are adverse reactions or falsified medication detected, we have Vigicarib, which reports to the Americas Regional Network and the Global Network, so that if something is circulated, we know. And then we are in partnership with Impacts, which is the current head of the security cluster of CARICOM. The security cluster of CARICOM impacts CARPHA, SEDIMA, RSS, JRCC. I may have missed out one or two. But we are in partnership with Impacts so that we have that aspect where unscrupulous persons are actually purposely circulating counterfeit medications. We have an arrangement with them so that we can strengthen our regulatory systems in the medicines arm, and also for the border controls, customs officers, please, because they will try to get this through shipments, through containers, etc. So we are working to try to strengthen so that if there's something, it's detected quickly and gotten out of the system before people come to harm.
Got you. Yes, yes.
And of course, we're working with Pablo on all of this.
All the fronts. You well, two things. You mentioned COVAX. You want to just say a little bit more about COVAX? Who's running it? I know you said that one of the ministers of the region is in the governance system of COVAX. But tell us just a little bit.
Okay, so there's a governance structure. WHO is a big player. But in terms of the vaccines arm of it, it is the Global Alliance on Vaccines and Immunization, Gavi. So there are three arms. There is the member states. There are over 180 member states signed up for COVAX. Then there is that governance structure with the WHO, Gavi, UNICEF, and then there are the manufacturers of the vaccines and the entities that are developing the vaccines, because the vaccine has to be developed. It has to go through trials where there is human testing of the vaccine. Then it will go through a regulatory entity, like how you've seen FDA. Well, for COVAX, we will be using whatever regulatory mechanism WHO has put in place. So the developers, the manufacturers, that's one. Then the entities that have ensured that the countries have come together, put in their down payments so that there's a guaranteed market, which would encourage the vaccine manufacturers to put in the infrastructure to not only produce safe and efficacious vaccine, but to ramp up to the volumes that would be required, because we're talking about billions of people
Yeah.
that have to get this vaccine. So it is quite a complex machinery to get this done and to get it done safely.
Yeah. The other objection I heard, and I'll ask you about how we're going to move these vaccines from wherever they start to wherever they need to get to. But before that, one of the other objections that people raise, up to recently, I was in a conversation with some people, and they said to me, they do not trust the vaccine because as far as they know, a good vaccine cannot be produced in so short a time. How do you deal with that kind of objection? What's your
Well,
experience?
that's a very common objection. That is what I usually hear first, because the ways that people are accustomed to, um, we've never seen a vaccine produced this fast and gotten to the stage where it can go to a regulatory authority like FDA. But what is in the background for this particular vaccine? Remember, COVID-19 is a member of the coronavirus family,
Yeah.
and we had SARS some decades ago. And there have been people who have been working on a vaccine for SARS for some time. So I was in London in January, and I heard one of these developers speaking about the fact that it would be simple for her to divert to make it for COVID-19. You would get the genetic makeup and so on and so forth, put it into whatever processes they have. So there is an infrastructure that would have been there, which has been adapted. That's number one. The second one was that, separate and apart from knowing that it was going to be COVID we would have to deal with, vaccine manufacturers were putting in technology so that they would be able to ramp up to any particular vaccine faster than they normally had. And then, third of all, there was the increase in the capacity to make billions of millions of, maybe millions is more sensible at this stage, millions of vaccine doses quickly. So there are three sets of infrastructure that were in place without knowing that we would have to deal with COVID.
Okay, good.
And those were in place. So COVID has now plugged into that infrastructure. But it is nothing to do with how it is made. What, for me, is the most important thing is that it has gone through those trials. And there's layers of trials, trial 1, 2, and 3, and some cases 4,
Tell us about those.
where persons volunteer to take the vaccine. And all of the reactions that they get, if they get the COVID set of people. So there's some people, and it's blinded, so you don't know who. They approach, they volunteer, they're going to get a shot. Some of them will be getting placebo, some of them will be getting the new vaccine. It is those trials that say if it is efficacious, and I will explain what efficacious is in a short while, and if it is safe. So these vaccines have gone through those layers of trial. And I listened this morning when the Surgeon General was speaking, when he and the Vice President took their vaccine, and he said how they made it a point to ensure that all of the different races of people, the Blacks, the Latinos, the whites, would be represented. So if anything was going to go wrong with any category of person, they would capture it. So for me, although everything is speeded up, the fact that those trials with thousands of people have gone on, that is the thing that makes me feel comfortable to take this vaccine.
Okay, thanks. No, what other challenges you think CARPHA would have in trying to ensure the quality of the COVID-19 vaccines used in the Caribbean? I know you said with COVAX,
With COVAX, and this is why we supported the down payments for COVAX
okay.
for several of the member states.
Mhm.
And there are two categories of member states. There are the ones who self-pay, and then there are ones who are to get concessions on the vaccines. There are 6 of them. And we've been shadowing the processes, and we intend to make available, in fact, we've written letters recently to the 6 in the AMC grouping to say, this is the amount of money that we have holding for you if you want it, if you need it. Once there is access to COVAX, I am more comfortable.
Yeah.
But you know what it is when you are watching on TV that in the US and the UK, people are getting vaccinations. Some people may say, but I don't want to wait on COVAX. I want to go ahead and get my own vaccine.
Yes.
From who I want to get it from, because US and the UK, this is not COVAX, you know. This is bilateral discussions between the countries and the vaccine manufacturers.
Yeah.
They pay down their money, they got their vaccine.
Mm.
So some people may say, I don't want to wait on COVAX. And they may go places which may not necessarily be the places they should go.
Mhm.
All I am praying is that nobody in the Caribbean goes to anyone who sells them counterfeit vaccine.
Vaccines.
Because this is what we are afraid of.
Yes. But
They will get
but
us.
can a government make a separate deal that does not come under the surveillance of CARPHA? Can a government access a vaccine?
Yes,
Okay.
yes, they can. They're
Okay.
sovereign governments.
Okay. So
So
then
I am hoping that they don't be put in touch with people who are not really going to give them quality.
got you that. Let me ask you this other question. This is my last question, and then I'm going to open it up in case you have other comments that we have not touched. But how could the ordinary citizen in our member countries, how can we help support CARPHA's efforts to make sure that this process works in the best interest of the region? What can we do? What can the ordinary person do?
It isn't just CARPHA that I want supported, it is the governments of our member states. I want you to trust our governments that they have been advised, not just by CARPHA, also by PAHO and WHO, and that they have your best interests at heart. And I want you to trust the governments as well as CARPHA. And I want you to support and follow the guidance and instructions so that if you are chosen, because remember, there's not enough vaccine being produced to cover everyone in the world. So people are going to be selected. If you are selected to be someone who gets the vaccine, I want you to follow the instructions. Right now, we're dealing with 2-dose vaccine candidates, but there are some 1-dose vaccine candidates. If you are chosen for 2-dose, I want you to follow the instructions. Come back for your 2nd dose. 1 dose is not going to cover you.
Yes.
You have to get the 2 doses.
Yes.
And if you are also someone who is selected, but you have a history of having severe allergic reactions to vaccines, and they say to you, no, you can't, follow their instruction.
Got you. Go ahead.
And I also want that people continue to wear their masks, wash their hands, and do their social distancing. Because for Pfizer, which is the first one, they have talked about the efficacy of the vaccine in terms of preventing severe disease. They have not discussed transmission. is a person still infectious with the vaccine? Moderna has come out to say that their vaccine prevents you from transmitting to someone else.
Mhm.
But it wasn't the first part of the authorization, it's an addendum, which now has to be considered by the regulatory agency. So you get your vaccine, continue to wear your mask, continue to social distance. I know a lot of people in the Caribbean have COVID fatigue.
Yes.
They're tired of that thing. They want to be
Yes.
free.
It is.
But in terms of a lot of people around the world, we are free
Yeah.
because we can still go to a restaurant.
Yes.
We can still go and shop. Some people can't do that.
Yeah. But let me ask you another thing. I said I was going to the last question, but before I get to the last question, another thing that I've heard, and I'm even hearing some leaders kind of, hinting at it. They're saying we have done everything we possible. We have contained the infection. Our country is safe. Why should we go into the vaccination program? Shouldn't it be just the US and the other people who are have high rates of infection? Because we are okay, we are doing the right things. So how you respond to that?
I would say that that is a bit on the foolhardy side.
Mm-hmm.
COVID is very sneaky because most of the people will be asymptomatic. COVID slips in. The person may have a negative PCR, but they may have been cooking COVID. So they slip in, they don't have a test again, they move about, they go on the minibus, they go to the beach, they go to the supermarket, they go to a government office, and somebody else picks up COVID. But because most of the cases are asymptomatic, COVID can be quietly building in numbers in your country and you don't know.
Okay.
So you can have situations like we've had recently with two of the countries in the OECS, which went from no cases to a whole lot of cases in a short space of time because you uncovered the sneaky COVID that was lurking around quietly. I think we need to prepare as if it is here among us, lurking, and take the vaccine.
Yeah.
The other thing is that we have a lot of traffic between those same countries, US, UK, Canada. Some of us have a heavy percentage of European visitors. Those countries are having serious upticks in cases. They may not be a tourist, they may be a business traveler who comes here for 2 or 3 days, but interacts with enough people that can cause an outbreak in your country. So let us protect. Let us protect. Having the vaccine and taking the vaccine before you have an outbreak in your country is better than saying, I will not have an outbreak, not securing the vaccine.
Mm-hmm.
And then you have a big outbreak in the middle of your tourist season opening up.
Yeah.
And you cannot get your tourism back.
Yeah, hold it back. Yeah, yes. But you. So, and you also said, well, a point you just made is that even some of the people who come down and say they have vaccine, for example, if they have the Pfizer vaccine, they could still transmit it to our people because they don't know for sure that they can't. Yes.
So until we get something specific from WHO, and I don't want to hear it from anybody but WHO.
But you.
Until we get something specific from WHO, even if people are vaccinated, we're still going to need the negative PCR.
Yeah.
We're still going to need the covering, the facial coverings, the mask. We're still going to need the hand sanitizing. We're still going to need the social distancing.
Yeah. Yes. Okay. Some other thing that's on my mind. We stopped quite a few things. So we stopped festivals, carnivals, and so. But I'm aware that since March, we've probably had about 5 elections around the Caribbean. Now that elections in itself and rallies and all of that usually become super spreader kind of events. What role did CARPHA play in these regional elections? Jamaica, Trinidad, St. Kitts, Anguilla.
So we worked specifically with the Trinidad Electoral and Boundaries Commission. And we came up with protocols to make the actual voting process safe. And we know that the health authorities would have advised on how to safely have rallies. Some of them had, like Trinidad, some of them had a blended model. There were just a few people allowed in the rally. They had to have the mask, they were social distanced, but the whole thing was videotaped or recorded and streamed live.
Okay.
So that people could take in the rally or the platform, we call it, some people call it, go and watch the politicians on the platform, but they would not be exposed.
Yes.
So Barbados had a by-election. We didn't have an uptick. Trinidad had their elections. They didn't have an uptick after the elections as such. And this would have been circulated to the countries after who had elections after Trinidad for them to use and adapt as they required. But there are some countries that the elections caused an increase in numbers. Some politicians died.
Oh.
So yeah, there's a country where a politician died.
Wow.
So, and there are countries that the prime ministers had it. It was announced. One of our member states.
They never told us.
So it is a country. It is a remember, CARPHA has 26 member states. So some of our member states are not mainstream OECS or Northern Caribbean.
Yes.
Right. So you had some cases in countries, or some issues in countries that aren't normally spoken about on our news. So it was advertised, but in that part of the world.
Okay, not for all consumption.
So the election process, if you're not careful,
yes,
it's still dangerous. But we have written protocols for practically every sector, not just elections.
Yes.
Practically every sector or phase of activity.
Excellent. I'm going to ask you to make any other comments you have, but something that's on my mind: how are we going to move these vaccines from country to country? I know we used to have LIAT, we used to have, how you intend to move it, especially those that have to be kept at this incredibly low temperature. How are you going to get them safely across?
Okay, so watched when the US was getting ready for their vaccines. And we are trusting PAHO to get our vaccines safely from the manufacturing plant to at least their hub. They have a hub. It's not in the CARPHA member states, but they have a hub
in the Americas.
And from there, I have to find out because PAHO is in charge of this element. But from there, we are assuming that they will get transport, and if not, we have been using the Regional Security Services Air Wing.
Yes, okay.
To collect samples. In fact, they're doing a run now to collect samples from countries in the Caribbean, in the CARICOM region, and bring them to CARPHA. We would need to have a specially outfitted plane for that.
Okay.
For RSS, but the pilots could do it.
Okay.
Because we know that they have been excellent. Not just the samples, we have had supplies PPEs that were brought to CARPHA for us to distribute to the member states, and they have done that very well. And they also have shipments of special cargo with two legs, humans.
Okay.
So yes, there's some people who have had to move, and there is no airlift. So we've had to rely on RSS. So we know that RSS can do it and do it safely because they've done over 100 missions for CARPHA.
Yes.
So
Okay. Yeah.
it's just for us to get this special outfitting so that that very cold temperature is maintained
Yeah.
during the flight.
Yes. Okay. Well, Dr. St. John, I thank you again for being with us. I know I imposed on you because we've known each other for several decades. So I'm happy I was able to get you out of vacation to do this, do this subject.
Decades?
But
Decades? Is it really decades?
a lot of them,
You're a young.
don't tell them they
Oh,
know,
yeah.
they know age. But if there's anything else you want to tell us about this critical issue, because it's on the minds of a lot, and you know, one of the things that struck me is that in various chat groups, I find myself answering questions, and then I say, well, wait a minute, I'm not the expert. I don't have any special expertise. I don't have the experience in this area. And I am aware that there are Caribbean people all over. You just happen to be back in the Caribbean, but you came from an international posting. And I'm saying, well, why not ask the people who know? So if there's anything else you think we should know at this stage, feel free to share. Yeah.
I want the Caribbean people, especially those from the CARICOM region, to realize the quality of the response from we're supposed to be small, under-resourced countries, but the quality of the response is measured by the fact that we have had few cases and even fewer
Yes.
deaths.
Yes.
And I want them, therefore, to show their faith at this stage of the pandemic. You know, a lot of people think the vaccine start, we done, we free. The work now start.
That's, yeah.
I want them to support their ministries of health, continue their mask wearing, their social distancing, and their hand washing.
Yes. Oh, thanks for that. Um, I am happy again to have you here and enjoy the Christmas season. And also I hope that if I get some burning questions again, I can send you a note and see if I can get your wisdom.
In the working hours, please. You like sending messages at 11:30 at night. Stop that.
Well, I work
Well, you can send it,
towards.
but I won't answer it.
Thank you very much. So right, so all the very best, and I really appreciate this. I'm sure our members will appreciate what you've done for us today. So thanks again. And
And if other questions come up, you can send them to us. We probably answer them in January though, because CARPHA goes on holiday officially on Monday.
okay. Okay, excellent. But I think you've answered the main ones. You know, those I think I've heard on the ground that you know, these are the burning issues. So I'm sure the others will be like when the vaccines actually get here, people might have, you know, certain concerns. So
Yeah,
then
there'll be a lot of questions when the vaccines come here.
yes.
Yes, there'll be a lot of questions.
Okay.
But
So
we're ready.
I'm glad I feel comforted. Thank you very much.
We're
Okay.
ready.
Goodbye, Dr. St. John.
Bye-bye.
Bye.